name is Tanisha Eldridge, and I will be doing a teaching learning presentation using cognitive information processing theory. My learning strategies are problem-based learning, algorithm, and demonstration. My reference group is the Perioperative Nurse Program. Learning outcomes: students will learn the definition of venous thromboembolism, commonly known as VTE. Students will be able to identify patients that are at risk for VTE. Students will be able to assess patients for the need of VTE prophylaxis. Good afternoon, class.
Good afternoon.
Ms. Eldridge.
Today we will be learning about venous thromboembolism, commonly known as VTE. We will learn what VTE stands for, VTE prophylaxis, what are the risk factors for VTE, and how to assess a patient for VTE prophylaxis.
Okay.
VTE comprises deep vein thrombosis and pulmonary embolism. Pulmonary embolism is a cause of deep vein thrombosis. VTE is the most common preventable cause of hospital death. VTE prophylaxis is an assessment tool used to prevent deep vein thrombosis and pulmonary embolism in hospital patients. This is an example of a blood clot that was found in a patient's lower extremity. This is the effect of the blood clot that was found in that patient's lower extremity and caused insufficient flow of blood to that lower extremity. The risk factors that put a patient at risk for VTE is age over 40, obesity, ICU admission, presence of central venous line, prolonged immobility more than 24 hours, past history of presence of lung disease or inflammatory disorder, and patients that are admitted with a history of heart failure, pneumonia, or serious infection, varicose veins, nephrotic syndrome, sickle cell disease, pregnancy, and estrogen use. High-risk factors are major trauma to the abdomen, pelvis, hip, or leg, ischemic stroke or paralysis that is non-hemorrhagic, malignancy, any prior history of deep vein thrombosis or pulmonary embolism. 2 or more of these risk factors is an indication for VTE prophylaxis, and 1 of these risk factors is indication for VTE prophylaxis. Now, you can group patients in this type of algorithm: low risk, moderate risk, high risk, or very high risk. Patients at low risk for VTE, the treatment is range of motion and early ambulation. Patients with moderate risk, you would use SCDs, sequential compression devices, and or medication. Patients at high risk, you would use SCDs and medication. Very high risk, SCDs and medication. And please refer to your handout for the list of different scenarios that would put patients in these categories. Now, how do you measure a patient for placement of sequential compression devices? Now, you have thigh length compression devices and you have knee length compression devices. Thigh length, you use your thigh circumference to properly fit the patient for a small, medium, or large. You would take a measuring tape. For thigh length, you would measure the circumference of the patient's thigh. If their thigh is up to 22, you use small, 22 to 28 is medium, 28 to 36 is large. Now, for sequential compression devices using just the knee length, you measure the calf circumference. And medium length is up to 21, large is 19 to 26, and extra large is 22 to 32. Do I have any volunteers that would like to come up and measure my leg for proper placement of a sequential compression device?
I would.
Okay, come on up. Now I'm going to put my leg up here, and I want you to measure my thigh for a thigh length compression device.
It is at about 21 and a half.
Okay, so 21 and a half, which length of thigh length would you use?
Small.
You would use a small one. And for a knee length, you measure at the calf. That is correct.
About 16.
And which size would you use for knee length?
Medium.
A medium. All right, thank you. Now, that is the proper way to measure a patient's leg for proper placement of sequential compression devices. Okay, does anyone have any questions? Okay, Jordan?
So if you were measuring the knee length,
Yes.
you would measure the calf.
Yes, that is correct. If you are measuring the patient for proper placement of a knee length sequential compression device, you measure the calf. If you're measuring for a thigh length, you measure the thigh circumference. Any other questions? Yes, Jordan.
If they were over a large in the thigh length, what would happen? Would it just be like an extra large?
No, they also have a sequential compression devices for extra large or obese patients.
Okay.
And I will give you the information for that. Any other questions?
What-
Yes.
What is a good way of preventing the blood clots in the first place?
Movement is a good way, but if you have patients that do not move, then we will go back to the risk factors. We will determine the risk factor, and we will treat appropriately to prevent this type of thing from happening. Any other questions?
No.
Thank you. And thank you for coming to class today.